We are in 5 and our topic is risk factors, knowledge, attitude, and practices of type 2 diabetes. Our presenter for today is Ms. Tabitha Mallampati. Ms. Mallampati is a nurse educator with a Bachelor of Science degree in nursing from the College of Nursing in England and a master's degree in nursing education from Central College, USA. Her area of expertise is in curriculum development and nursing education, teaching methodologies in nursing education, leadership and management roles in nursing, leading a change process, nursing professionalism, evidence-based nursing practice. Ms. Mallampati's research areas of interest are diabetes mellitus, non-communicable diseases, nursing education, and communicable disease. And now hand you over to our presenter, and hope you enjoy this presentation.
Good morning, everyone, and thank you very much, Chair, for that kind introduction. The topic of my study is, the title of my study is Risk Factors, Knowledge, Attitudes, and Practices of Type 2 Diabetic Patients attending Campbellville Health Center and Industry, Campbellville Health Center and West Demerara Regional Hospital in Guyana. So the background for this study, diabetes mellitus poses a significant public health challenge in the Caribbean region due to epidemiological and nutritional transition. Guyana has an adult diabetes prevalence of 15.9%, the second highest prevalence of any country in the Americas. Studies indicate that an estimated 80% of causes of diabetes could be prevented by simple lifestyle modifications. Background continued, the overall prevalence of type 2 diabetes in the Caribbean region is estimated to be approximately 9%. Lifestyle changes such as unhealthy dietary practices, physical inactivity, obesity, and substance abuse are significantly contributing to a higher incidence of diabetes and heart diseases in the Caribbean region. This is according to PAHO report in 2013 and Boeing 2009. Diabetic-related deaths are responsible for 13.8% of all deaths among adults in the Caribbean region. Trinidad and Tobago has the 5th highest per capita rate of diabetes in the world and the highest in the Western Hemisphere. Justification for this study, in Guyana, approximately 24,000 to 36,000 people, which is 8 to 12% of prevalence, are living with diabetes, and 40,000 to 50,000 people, which is 16 to 20% of prevalence, are living with hypertension, and a combined 54,000 to 68,000 people are living with the 2 chronic diseases. Non-communicable diseases contribute to 70% of all deaths occurring in Guyana. These represent the leading cause of premature deaths before the age of 70 years. This is according to Ministry of Health report 2015. Reports indicate that regular assessment of the risk factors such as BMI, laboratory tests, physical inactivity, and unhealthy dietary practices provide an opportunity to assess diabetic patients' understanding of the disease and their ability to control it. Another study indicated that attaining glycemic control, early detection of diabetic complications, assessing and managing comorbidity are critical components of diabetic care management. Ongoing diabetic education of patients and their families is imperative in managing diabetes and preventing diabetic complications. This is according to a local study done by Kurup Ansari Singh and Cummings in 2019 and 2014 respectively. There is a gap in the literature regarding the assessment of the risk factors, knowledge, attitudes, and practices of type 2 diabetic patients attending the community health centers in and around Georgetown. Hence, this study was designed to assess these factors affecting the type 2 diabetic patients attending the health centers in 3 different communities in Georgetown and West Demerara Regional Hospital. So the purpose of this study is to examine the risk factors, knowledge, attitudes, and practices of type 2 diabetic patients attending 3 selected healthcare centers, which includes Industry and Campbellville Health Centers and West Demerara Regional Hospital in Guyana in the months May and June in 2019. Methodology for this study. This study has utilized a quantitative, descriptive, and cross-sectional approach. The sampling method used was a non-probability and purposive sampling. The participants included a total of 114 diabetic patients attending 3 selected healthcare centers. The Institutional Review Board from Ministry of Public Health and the medical directors of the 3 selected facilities provided ethical permission to conduct the study. Prior permission was taken from the participants using consent forms. All confidential procedures were carried out throughout the project. Survey tool for this study was developed using the existence literature. The tool was pre-tested for reliability and validity purposes. This is an image of a health center at Campbellville. And this is West Demerara Regional Hospital, where I have used another health center for chronic diseases. The results of the study. Chi-square test revealed that risk factors such as age, sex, ethnicity, family history, and BMI had no significant relationship with the onset of diabetes since p-value was greater than 0.05. Participants in the study demonstrated inadequate level of knowledge and unhealthy practices. The mean average of blood test results such as RBS, BP, fasting blood sugar, HbA1c, and lipid profile of the participants were high. Results revealed that some patients, which is 30%, had challenges to access insulin and some of the laboratory tests. The table here outlines that 71% of the participants in this study were female, 33% of the participants were diagnosed with diabetes equal to or more than 5 years, 54% of the participants were overweight, 46% of the participants had comorbidity, which was hypertension, 68% of the participants had a family history of diabetes, 56% of the participants had a family history of hypertension. For the question, when was your diabetes diagnosed? 33% of the participants indicated that they were diagnosed less than or equal to 5 years. 23% has responded that they were diagnosed for 6 to 10 years. 18% indicated that they were diagnosed with diabetes 11 to 15 years. 23% of the participants indicated they were diagnosed for more than 15 years. So we can see a trend. We can see the prevalence of diabetes growing from 18 to 23, and now during last 5 years, it is 33%. This is a cross tabulation between family history of diabetes and when was diabetes diagnosed. 44% of the participants who were diagnosed with diabetes for less than or equal to 5 years indicated that they had no family history of diabetes. 29% of the participants in the study who were diagnosed with diabetes for less than or equal to 5 years indicated that they had a family history of diabetes. Again, here you can see the prevalence of diabetes is growing among people despite they having family history of diabetes. So when during 6 to 10 years, it was 16%, and during last 5 years, it is 44%. This is a multiple bar indicating the comparison between body mass index and when diagnosed with diabetes. The yellow bar here indicates that these participants were overweight. And this is the duration of the diabetes. So you can see that during last 5 years or less than 5 years, the participants with overweight has increased in number compared to the previous years. So the study participants, majority of them were overweight. So that is another risk factor that this study has highlighted. So here there is a table which indicates the laboratory findings of the participants. The mean average of blood tests, current blood tests such as RBS, fasting blood sugar, HbA1c, triglyceride, cholesterol, HDL, LDL, VLDL, BUN, and creatinine were high. So you can see the mean, for example, you can see the mean of patients' current readings of RBS was 189.35 with a standard deviation of 101.45. So relatively, all these blood reports were high. Have you been told you have any complications of diabetes affecting? For that question, majority of participants indicated that they were told that they had diabetic complication of eye related to their eyes. And secondly, participants indicated they had no complication. And thirdly, participants indicated that they were told that they had complications of nerves or feet. Fourthly, patients were told that they had complications of heart. And fifthly, patients responded that they were told that they are having complications related to their kidneys. And sixthly, related to blocked arteries in their legs. And lastly, the participants were told that they had complications in relation to slower digestion. So this is the table that indicates that, majority of the participants were told that they are also suffering from diabetic complications. They were told by their healthcare professionals in the clinic. So that is another risk factor. Further questions related to healthy practices. Do you exercise for at least 30 minutes per day on at least 4 days of the week? Only 57% indicated yes, and 43% of the participants indicated no, they do not exercise for at least 30 minutes per day on at least 4 days of the week. Are you following a controlled diet recommended by a healthcare worker most of the time? 65% of the participants responded yes, whereas 35% of the participants indicated no. Do you often mistaking the doses of your diabetic medication? 32% of the participants said yes, they do miss taking the doses of their diabetic medication, whereas 68% indicated no, they do not miss. For the question, do you monitor your blood sugar at home? A majority of 64% of the participants from Industry Health Center 70% of the participants from Campbellville Health Center, and 67% of the participants from West Demerara Regional Hospital indicated that they do not monitor their blood sugar at home. Discussion regarding the risk factors. Findings of the study supported the existing literature. Results disclosed that the risk factors such as ethnicity, family history, and BMI had no significant relationship with the duration of diabetes. These findings supported the literature that diabetes has growing prevalence among all ethnic backgrounds due to epidemiological transition. So other studies similarly found out that diabetes has been growing among other ethnic background. Regarding healthy practices, findings supported that the knowledge of participants regarding healthy practices is inadequate. And these practices included dietary practices, exercise, regular monitoring of blood pressure and blood sugar, and foot examination. The findings are similar to the existing data, which was studies carried out by Kurup, Ansari, Singh, and Cummings, which are local studies. Friedman tests revealed that the most of the participants checked their BP, RBS, and feet for cuts only when they visited the clinics. And these results were similar to another regional study, which was done in Trinidad. Regarding the diabetic complications, results revealed that the knowledge level of the patients regarding diabetic complications is inadequate. Results of this study supported another study done in Guyana, which was projected that the knowledge, attitudes, and practice levels of diabetic population regarding complications attending the diabetic clinic of the Peter Hall's Jamaat in Guyana was inadequate. A research study conducted on diabetic foot challenges in Guyana highlighted that patient education was the most effective tool that could assist with early detection, lessen the complications, and assist with the management of diabetes. So my study results also support that patient education is critical in curbing diabetic complications and also enhancing patients' quality lifestyle. Self-care management. Findings of this study reiterated the need for self-care management programs. Several studies proved that diabetes self-management education is an effective intervention strategy that enhances diabetic knowledge and provides the best treatment outcomes. Local studies showed that the low health literacy was associated with higher HbA1c and random blood glucose levels, according to McNaughton study in 2015. Clearly, in response to this need, a self-care management program should be a highly priority intervention. Multi-sectoral self-care management programs. A participatory action research study conducted in United Kingdom among the Guyanese population has successfully connected, engaged, and socially empowered the participants by group therapy and participatory community approaches. And this study was carried out by Dr. Mitchell in 2017. Hence, this study recommends that establishing culturally tailored and multi-sectoral self-care management programs are critical. Additionally, results support the existing data that ongoing training of healthcare workers and diabetic education programs are critical measures in managing diabetes care in Guyana. So this study also supports that the ongoing training for healthcare professionals is very essential so as to provide effective diabetic self-care management programs. Nursing implications. The data generated in this study will help in policymaking and developing holistic, evidence-based, culturally competent, and multi-sectoral diabetic self-care management programs. concluding recommendations, establish ongoing multi-sectoral culturally tailored and evidence-based diabetic education programs in managing the disease, provide adequate and ongoing training for healthcare workers. Policymakers from the government and non-government agencies should collaborate and maximize human and material resources. Establish comprehensive, multi-sectoral, collaborative, and innovative measures. Enhance accessibility of healthcare services to all Guyanese population to combat the disease effectively. These are the references that were used in this presentation. And I thank you.
Thank you very much, Ms. Mallampati, for that presentation. We will now open the floor for questions from the audience. You can type it in the chat, and we will read and have Ms. Mallampati respond.
Or you can unmute themselves and answer.
Or you can unmute and ask your question. The floor is open.
Okay, good morning, everyone. Just want to say a few comments. This is an excellent presentation, Ms. Tabitha. Congratulations. And it's a nice study to know, and it's a local study about risk factors among the population in Guyana. And there, of course, there were extensive studies done in diabetes and hypertension related risk factors and knowledge and attitude and practices. And I'm happy that to see a lot of local studies you have compared with, which is very good, and to make sure that it is established fact that the risk factors are more high prevalent less than 5 years. The reason can be maybe because of our healthy lifestyles have been influenced by sedentary lifestyles plus maybe unhealthy eating practices. Because the one study which I did, it found out that a lot of people accustomed to eating food outside, so that can be fast food restaurants and so on. So that could have influenced the high prevalence of diabetes. And one more comment I want to make is the reason, what was the reason why you chose only these 3 health centers? Is it because in these communities, incidence and prevalence of diabetes was high, or is ethnic background, was it that reason you chose these 3 health centers? Just would like to know. Thank you.
Thank you for those comments, Ms. Stefanas. And yes, it's a very good question. The reasons for choosing these health centers, number 1, is feasibility. It is easy to access because I live very close to Industry Health Center and also relatively close to Campbellville Health Center. And second reason is Campbellville Health Center has a mixed group of population with the different ethnic backgrounds, and industry being, predominantly Indian communities, and West Demerara also Indian communities. So I have chosen Campbellville Health Center, which is a larger health center in Georgetown, where a great number of population has been utilizing the health services from Campbellville Health Center, and also for the reason that population from all ethnic backgrounds are attending Campbellville Health Center. And West Demerara was also chosen because the clinic there also is very huge. A lot of diabetic patients are attending West Demerara Health West Denver Hospital clinic. So I can say these are the two main reasons for which I have made decision to choose these health centers.
Yeah, thank you. Yes, you're right. And I think even one more reason can be because of diabetes is more prevalent among Indo-Guyanese. That's what some of the studies have proven. So these communities also have more prevalent. Of course, there are other ethnic background persons also, but diabetes is more common among Indo-Guyanese and so on. Yes, and females. Yes, according to your study also it has supported it. Yes, thank you.
And also we can say that, a combination of urban and rural. So I can say Campbellville is urban since it is in Georgetown, and industry and West Dem can be rural communities.
Yes, yes. It's a nice study. Hope we can have some further follow-up. Maybe we can even recommend, find out like young adults or adolescents also have, we have to educate them so that they won't go into this kind of unhealthy lifestyles and so on. Yeah.
And since we have time, I just want to extend one more comment on the remark that you made. Diabetes is common among female ethnic background, but my study has proven that there is no significance, no association between ethnic background and diabetes diagnosis. Because if you can see the results that I have found out in this study, the patients who were diagnosed with diabetes, especially in Campbellville Health Center, they're from other backgrounds too. There is increasing number among Afro-Guyanese and also Amerindian communities. So that is what my study found out, that the prevalence has been increasing from all ethnic backgrounds, people from all ethnic backgrounds. That is what my study has proved, and also supported the existing literature that the trend is changing now. Despite of your ethnic background, your lifestyle, ethnic background, despite of your age, despite of your community, diabetes has been growing, and the prevalence has been growing.
Yeah. Yeah. Thank you.
Thank you for those questions.
Thank you very much. Are there any other questions from anyone in the audience? Okay, thank you very much, Mrs. Mallampati, for your presentation.